I'm going to talk about some of the methodological challenges that I encountered doing research on irregular migrants over the last 10 years. And as Pablo mentioned, this is part of the research I conducted between the Migration Policy Center in Florence, where I am now, and the NCCR on the Move, which is a large consortium with different universities based in Switzerland. So I'm going to say a couple more words about this research later. I wanted to give you a broad question that has been on my mind for the last few years, as I mentioned, and it's very broad. But the question really is, why is it that irregular migrants have access to public healthcare services in some political communities, some countries, some regions, some municipalities, but they do not get the same rights in other political communities? And I will base most of this presentation on two different articles that I wrote on the topic. The first article that you see on the left of your screen is entitled Traditions of Regional Citizenship, explaining the subnational variation of the right to healthcare for undocumented migrants, which was published 3 years ago on regional studies. And the second article, it really is on the political determinants of the health of undocumented immigrants, focusing on Switzerland. And it has been published on BMC Public Health a couple of months ago in 2022. So just a few words on the background for this research. I suppose most of you are acquainted with the topic of irregular migration, but for those of you who are not, I wanted to clarify that irregular migration, according to the definition of the International Organization for Migration, really is any movement that takes place outside the regular framework of the different political communities where international migration takes place. And in public debates, there is generally an understanding that irregular migration is about the act of crossing an international border without having the regular permit to do so. And this is indeed one of the causes of irregularity. But there are many others, and actually the most frequent cause of irregularity for individuals is arrival in a country with a regular permit, with a visa, and then the choice to remain in the country after the expiry of the visa. Studies conducted in the US, but also in the UK and in other countries, show that about 60% of irregular migrants become irregular in such a way and not by irregular border crossing. And then, of course, there are other ways. For example, people who come to a country, apply for asylum, are rejected, but decide to stay irregularly. I wanted to mention these things in the background and also remember everyone that the choice of the words that we use to describe this phenomenon really matters, has consequences in the way in which we then describe the issue. So some people refer to irregular migration. That's what I will do in this presentation. But other scholars also talk of clandestine migration, unauthorized migration, illegal migration, and then, of course, undocumented, because those people who are the object of the study lack the permit to stay in the community where they live. So this was the background. And I should also mention, you will have noticed by now, that most of the studies on irregular migration have been conducted in the so-called global north, in Europe and in North America, where it is estimated that irregular migrants are about 1 to 3% of the population. So it is an important phenomenon, although it's not a massive phenomenon, as sometimes you may have the impression by reading the news. There have been some preliminary studies on irregular migration in the so-called global south, but we still lack estimations and analysis. And that's one reason why I've chosen to focus on this topic, because I would like to encourage more efforts to study and understand and explain irregular migration and access to healthcare for irregular migrants outside those geographical areas that are Europe and North America. That being said, I'm going to talk about some of the methodological challenges, and I wanted to think about data collection methods for irregular migrants for studying irregular migrants when it comes to their access to health. And I think it's important to think about this specific group of the population because it comes with specific challenges. Irregular migration is a hidden phenomenon. We don't have many surveys, many data available, which is why it's very hard to conduct quantitative research on irregular migration. And so when I approached this phenomenon a few years ago, being a political scientist, the first sources of information that I used were the legislation and all the measures leading to the adoption of certain laws and certain regulations in the communities that I was studying. And those communities were the different regional assemblies in Italy, in Spain, and in Switzerland, just to give you the context. But I do think that what I'm saying now is really applicable to any political community. So that's what I did first. And I looked at not only the actual law as it's written on paper, but all the process leading to the adoption of that law or the lack of adoption. Of course, sometimes laws giving basic healthcare rights to irregular migrants are debated and then are voted down in an assembly or never reach the assembly. So it's important to try and understand whether there are transcripts of debates in special committees within the different assemblies. And then, of course, a lot of discussion is reported by newspapers. So secondary sources are important to get a sense of the type of declarations that people involved in the process have made. And sometimes there are reports by civil society organizations that are very useful to understand, again, those different interests and the power dynamics behind the adoption or the lack of adoption of certain services. The problem with those data is that they only tell a part of the story. They are, of course, very selective, will never manage to get the full story only by looking at what is written on paper. Also because oftentimes there is a significant difference between what the law says and what it then happens in reality, the so-called implementation gap. All of this to say, those sources are a very good starting point if you want to conduct research on irregular migration and the measures that exist in different political communities towards irregular migrants. But that's not enough. It's really important to combine, or as we say, to triangulate those sources with other sources of information to get the full story. Those other sources of information, in my case, have been interviews. Not any interviews, but interviews with those who have a special knowledge on the decision-making process, again, leading to the adoption of certain services or the decision not to adopt those services for irregular migrants. Those interviewees can be the policymakers involved, elected politicians from different parties, but also people with a special expertise on these specific topics. So fellow academics, individuals from the civil society, journalists, but also, and in my case, that was very important since I was doing research on access to healthcare, those who do provide healthcare to individuals, doctors, nurses, medical workers in general. And that is important because, again, it does help to get a better sense of the full story behind certain decisions to be taken. It also helps to understand the actual implementation of different laws and the mechanisms in which the laws have an effect. The problem with those interviews, at least the problem that I encountered, and I suppose many of you have also encountered by doing research on different groups of migrants, not only irregular migrants, is that it is much easier to get access to interviews with those people who are in favor of expanding the rights for irregular migrants or who have actively struggled to expand those rights in different contexts. And this is problematic because, again, we want to get the full story. We want to hear also from those who oppose the expansion of those rights. So how to get over this problem? I do not have a good answer to that, but my recommendation is to trying to approach as many people as possible, and never to frame the interview as a way of eliciting people's own ideas or opinions on the issue, but rather start from a precise empirical case, an empirical discussion or something that happened. And then based on that, it becomes possible to ask more precise questions and follow-up questions. And this is very important because, as I said, we really need to try and get the opinion of all the people, those who are in favor of expanding the rights and those who are against expanding the rights, if you want to do a good scientific service. Now, there is, of course, another group of people whom it would be crucial to interview to better understand the situation and to explain different outcomes, and that is irregular migrants themselves. I've never followed this approach for the reasons that I will now explain. There are many people who have done brilliant research by conducting interviews or doing ethnography with irregular migrants. The problem for me is that this approach is extremely time-consuming. It takes time to identify irregular migrants, build a relationship of trust, and then do interviews. And as I said, it's actually much more than just interviews. In this case, it becomes a full ethnographic research process. Once you've done that, and even if you manage, there are other issues that open up, ethical issues about how to use the information that you have acquired without creating harm for the people with whom you've been spending your time. So for all those reasons, I did not use this approach, but I do commend the work of people who have invested actually a few years of their lives conducting ethnographic work with different communities of irregular migrants. Finally, there is one more approach that I think it's worth considering, and this is the approach that I used in the second article that I mentioned a few minutes ago, and that is public health statistics. So earlier on, I mentioned that it's very hard to use quantitative data when studying irregular migrants because we lack reliable numbers, reliable estimations of the number and the habits of irregular migrants. When thinking about public health, however, there are some tools that we can use. For example, surveys of reported health from all people living in a community. And also, and this is what I've done, registers of mortality in different communities. And I want to say a couple more words about this, because this was, again, the approach that I followed recently. What we did is we, together with my co-author, Philip Wanne, a professor at the University of Geneva, we got access to the register of mortality in Switzerland over a 6-year period between 2011 and 2016. And in that register of mortality, we had very precise information on who died in Switzerland. And we separated what we estimated to be the deceased irregular migration population, largely based on those people dying without a regular permit to stay in Switzerland, and by coming from nationalities that are generally likely to be irregular if they lack a document to stay, differentiating that group of the population from two other groups, those who were also were migrants in Switzerland, did not have Swiss nationality, but did have a regular permit to stay, and of course, Swiss nationals. And this was useful, we hope, because we managed to understand the different causes of mortality, the frequency of different causes of mortality for those different groups. And if you read the article, you will see that we conduct analysis to show that irregular migrants die more frequently for infectious diseases, for example, contagious diseases, than the other two groups of the population, regular migrants and Swiss citizens. The problem with this approach, there are two problems. Number one is that we actually don't know the numbers of irregular migrants who are living in Switzerland. So we can only talk about frequencies of mortality and we cannot analyze their likelihood to die for one cause over another or the rates of mortality. And the second problem is that it's difficult to apply this approach to other countries. Switzerland was very good because the register of mortality is extremely clean and accurate and contains a lot of information. Unfortunately, that's not the case in most communities around the world. So we really have to find the places where those kind of analyses can be conducted. Now, back to the different data collection approaches that I discussed. This is the complete overview. And after this presentation, I would encourage you to get in touch with me if you think there are other methods that can be used to study different ways in which irregular migrants are given or are not given access to basic rights, including rights to healthcare services. I do think, and I wanted to conclude on this, that the choice of the data collection method should be carefully weighted against the exact question that you are asking. And the reason why I say this is those data collection methods allow you to answer different questions. Specifically, you may remember I started with the question, why is it that different communities give different rights to irregular migrants, specifically looking at the right to healthcare services. I think that this question can be best answered by using the first two methods of data collection that I mentioned. Because by looking at the legislation and by talking to the people who have produced the legislation, we can understand the different logic of people pushing for or against the expansion of rights. Using those data, we can also understand, as I mentioned earlier, the exact mechanisms through which different rights are given or are not given to affected people. The mechanisms can also be understood, I think, if we talk to irregular migrants themselves. So how is it that you can have access to certain services? And importantly, by talking to this group of the population, we can answer another question, that is, what are the consequences of different policies for you, for the affected population? This question we cannot answer if we only look at the legislation and if we only talk to decision makers. But this question we can also answer partially by using the registries that I discussed, because that is really about the outcomes of different policies. So you see what I mean, different data collection methods are really conducive to slightly different answers. And I think this is important to keep in mind. And just to wrap up of the different things that I said, we started with the understanding that it's important to be reflexive about the methodology, the terminology that we use, the vocabulary that we use. This applies to all studies of migration, actually to all studies in the broad field of the social sciences, but it's particularly important when we study irregular migration. As we said, different data collection methods should be used to answer slightly different questions. And for me, I find it very nice to combine those different methods to answer different questions. After I had answered the first question for my cases, I really wanted to understand a bit better the mechanisms and the consequences of different policies. I've spoken a little bit more specifically about some data collection methods. In particular, I think the challenge we have to keep in mind when looking at the legislation, as lawyers would do, is to reflect on the fact that sometimes rights on paper do not correspond to the rights that people have in practice. So think carefully about the implementation gap. When conducting interviews with those who are part of the decision-making process, I think it's important to talk about concrete decisions and events rather than about their own ideas, because this would make it easier to find more people to interview. And just on a very practical side, I also recommend everyone to build a timeline of the key events, because it does work as a very useful background material for you to sort of map and track the different services that are made available or are not made available to irregular migrants in the community that you are studying. And finally, public health registries have been, in my case, a very precious source of information that allowed me to understand, that allowed me to prove that there is a difference in the outcome of policies for irregular migrants when compared to other groups of the population. But as I mentioned, it's very difficult to access those registries and to have information that are precise. We were lucky in the case of Switzerland. I recommend you try and do the same in different communities where you are, but be mindful of the data that perhaps are not recorded in the register because of a different quality of reporting by the administrations. Of course, this was only a 25, I think, minute presentation, so there are a lot of stones that have been left unturned. I do recommend you to get in touch with me if you are working on this topic or on similar topics. If you have questions on this presentation, on the articles, if you will find the time to read the articles, I'm always happy to talk, and I would love to develop some collaborative projects with people working in different communities. So please do write to me. Those are my contacts. And thanks a lot again for your time. Best of luck for your different research endeavors. Thank you.